virtual World AIDS Day program. Thank you so very much for joining us today. We would just like to start out by going straight into an invocation. We'll have Pastor Darnell Gooch provide the invocation.
Dr. Darnell Gooch, Jr., pastor and founder of the Cathedral Praise Church of Memphis, the Cathedral Foundation, and Tri-State Black Pride. Let us gather for prayer. God, today we thank you for allowing us to galvanize your people, your churches, and organizations together so that we may remember those who have died from HIV and AIDS. We thank you today that you have allowed us to be able to afford the opportunities so that we may come up with new technologies, new medicine, cure, and treatments so that individuals may be healed of this disease. We thank you for the diversity. We thank you for the support. We thank you for the love and being able to be a beacon on the hill, a light for those in dark and dismal places. We take this moment to say thank you for those that have come together to help us in this celebration. We pay homage, we salute them, and we say thank you for the great work that we are embarking upon in 2020 and in the years to come. In Christ's name we pray, amen.
Now, we want to really focus on Ryan White, the story of Ryan White, the funding that we received through the Health Services Resource Administration, and also our project officer, Emerson Evans. We'll now hear from them.
I've been involved in the fight against HIV since 1985. That was the year that my late partner was diagnosed and died. And so for me, this entire epidemic is very, very personal. And personally, I've been living with HIV for now 38 years. And so this epidemic has almost defined my life, both personally and professionally.
I got involved at my diagnosis, November the 21st, 1990. I was 13 weeks pregnant and I was diagnosed with HIV. So I look at it that I immediately got involved, immediately sharing with my partner the same day, but then getting information to start educating my family about the virus, and not just about me and the virus had come into our life, into our family.
When I first started in 1990, people had very short lifespan expected. So the response to that was to really provide services to help people maintain their dignity and die in dignity. Early in the epidemic, the Ryan White program was passed into law because of the huge stigma around HIV and the fact that people had a hard time accessing care and treatment services at that time.
Ryan White HIV/AIDS program has evolved over the years to meet the needs of people living with HIV and to help the programs better meet the needs of the changing needs of people living with HIV over the years, because it's really had a person-centered approach. It's been driven by the people who are in need of services and given clinics, programs, localities the ability to really tailor those services to the needs of the people in their community who are affected by HIV.
The Ryan White program has valued those people. It's encouraged their voices, because unlike any other health-focused program, it demands and has demanded for decades that the voices of people living with HIV guide where the services should go. And I think that model has been tremendous, and it's one that needs to be replicated in every health issue across America.
The Ryan White program changed throughout the years as the science advanced, the program advanced and had to change. Early in the epidemic, we didn't have many medications. For many years, we only had one, AZT. And so the program actually focused on providing care for people with HIV, helping them to live and to die with dignity. And then as more therapeutics became available, as treatments improved, we were able to move from just a care program to more of a full program of care and treatment.
The Ryan White program is really essential. It's one of the only medical programs in the country that integrates medical care and essential support services. So someone diagnosed with HIV, we know that people that are living at or below the poverty line often need many types of enabling services in order to get into care and stay in care. With Ryan White, that's essential in HIV because people need to stay on their medications and take them every day. Going on and off medications can lead people to develop resistance to treatment.
30 years ago, I was the first Ryan White Planning Council chair for Philadelphia. It's hard to believe that that's 30 years ago, but when I was asked to take on that role, I could never have envisioned how important the Ryan White program would be, not just for Philadelphia, but for the entire country.
The biggest impact the Ryan White program had provided for people living with HIV is real simple. I'm sitting here. It's 30 years later. Providing life-sustaining care, treatment, respect, information, education. That's really the biggest thing. The Ryan White program has always made sure that community had voice in this engagement of the epidemic from its inception till right now, 30 years later.
Good afternoon. My name is Emerson Evans. I am the project officer for the Memphis TGA. I would like to first thank you for your recognition during your virtual World AIDS Day event. Secondly, in this unprecedented year and challenging year, I would like to thank you for your continued hard work and dedication towards serving people with HIV. You are greatly appreciated.
Those words. Next, I will be introducing the Director of Shelby County Health Department, Dr. Elisa Haushalter. She's not only the Director of Shelby County Health Department, she's also an Associate Professor at University of Tennessee Health Science Center, College of Nursing. Dr. Haushalter was appointed Director of Shelby County Health Department in 2016. She is a seasoned public health nurse and leader, a dedicated person. Also, she has been recognized as a transformational leader and received multiple awards and recognitions. Dr. Haushalter.
Thank you, Sherry, for that introduction. I also want to thank each of you for joining us virtually, and thank those of you who will watch us in the future. And while I always appreciate the introduction, this event is special to me. I have had an opportunity since being in Shelby County to participate in World AIDS Day, and it serves as a reminder to me of the patients that I've seen as a public health nurse dating back to the 80s. And it's a reminder to me that we have a continued need to fight to reduce the impact of HIV/AIDS on our communities. I'm going to deliver a few remarks and then share a proclamation from Mayor Harris. Every year on December 1st, the world commemorates World AIDS Day. People around the world unite to show support for people living with and affected by HIV. And most importantly, we remember those who have lost their lives to AIDS. In 2020, the world's attention has been focused by the COVID-19 pandemic on health and how pandemics affect lives and livelihoods. COVID-19 is showing once again how health is interlinked with other critical issues, such as reducing inequality, human rights, gender equality, social protection, and economic growth. With this in mind, this year's theme of World AIDS Day is Global Solidarity, Shared Responsibility. COVID-19 has demonstrated that during a pandemic, no one is safe until everyone is safe. Eliminating stigma and discrimination, putting people and their needs at the center of the response, and grounding our responses in human rights and gender-sensitive approaches are key to ending the twin pandemics of HIV and COVID-19. The COVID-19 pandemic has once again revealed the entrenched inequalities that exist in our society. This particular health crisis, like many others, is hitting the poorest and the most vulnerable and hitting them the hardest, much like HIV/AIDS. I'm going to introduce a word that's syndemic. So we've talked about epidemics and pandemics. Syndemic really shows the interconnection of all of the things that I've just mentioned. The impact of poverty, historic racism, historic inequalities, and multiple diagnoses, which compound to assure that people have poor health outcomes rather than positive health outcomes. So it's critical that we do move forward in solidarity and that we have shared responsibility for each other's health outcomes. Now is the moment for bold leadership for equal societies, the right to health for all, and a robust and equitable global recovery. Not only for those living with HIV/AIDS, but for those at risk of COVID-19. This is what is meant by global solidarity and shared responsibility. Fighting these twin pandemics here is like fighting them everywhere. Our efforts against HIV/AIDS and COVID-19 not only benefit those in our community, they will benefit generations to come, both here and around the world. Mayor Harris is not able to be here with us this afternoon. He's well aware and supportive of the need to address HIV/AIDS in our community, but he's also very supportive of striving for equity for all people and really embracing inclusion. So on his behalf, I want to present this proclamation to those who are listening. I'm going to highlight a few comments within the proclamation. Whereas World AIDS Day serves to focus global attention on the devastating impact of the HIV/AIDS epidemic and to support people living with HIV, World AIDS Day was established in 1988 and was the first ever global health day. And an estimated 38 million people worldwide were living with HIV at the end of 2019, and nearly 33 million people have died from AIDS-related illnesses since the start of this epidemic. I want to repeat that section. Nearly 33 million people have died from AIDS-related illnesses since the start of this pandemic. In Shelby County, African Americans have the highest rates of people living with HIV, followed by Hispanics, Latinx, and Caucasians. The Centers for Disease Control and Prevention reports limited access to health care, housing, and HIV prevention education may contribute to the worst outcomes for African Americans on the HIV continuum of care. The theme for World AIDS Day 2020 is Global Solidarity, Shared Responsibility, and the day serves as an opportunity to reflect on global health responses, including the AIDS response. This year highlights the need to expand access to health care and foster an approach to a centered approach to human rights and dignity. Thank you.
Thank you so much, Dr. Haushalter, and a special thank you to the Honorable Mayor Lee Harris for that proclamation. Next, we're going to invite you to just listen to what we have from our faith-based community. We just have a quick message because it takes all of us. As you heard, this year's theme, it's a shared responsibility. So not only is it global solidarity, but it's shared responsibility. So next up, you'll hear from our faith-based community partner, as well as some of the sub-recipients who are doing the work in our community.
Welcome to Hope House. My name is Brandy Taylor, and I am a T-Bird Ryan White social worker at this wonderful organization. We know that once upon a time, when a person received a diagnosis of HIV, they were given a death sentence. But thanks to so many medical advancements, that's no longer the case, and individuals can and have been living a long and healthy life. Here we at Hope House know that's still difficult because they still face day-to-day challenges such as living in poverty and facing the stigma and discrimination that comes along with living with HIV. We at Hope House offer services to these individuals living with HIV and their families to help them overcome these barriers. We offer mental health services such as individual and group counseling. We have a housing program in addition to emergency assistance for rent and utilities. We have victim services for those individuals who may have been a victim of a crime. We have an early childhood program for children ages 6 weeks to 5 years of age. Thanks to our valued community members, we have a donation pantry that allows us to give our clients cleaning and hygiene products. We also have a food bank that is supplied by the Mid-South Food Bank and other donations that operates Monday through Friday, 8:30 to 12 noon. If you or someone you know needs free HIV testing, or you know someone that has been newly diagnosed and needs linkage to care and other sources, please contact our office at 901-272-2702. We at Hope House know that there has been a long battle against HIV, but we will continue to strive to offer our clients the services that they need to overcome and improve the quality of their life and transition from surviving to thriving.
So Out Memphis is an LGBT community center, and we work with a wide variety of people from our community. Everything from youth, seniors, our trans community, and we also offer health and wellness services, which is what I oversee. And our partnership with Ryan White has helped us tremendously with our mission in terms of serving the LGBT community here in the Mid-South. Through help from the Ryan White, we've been able to do outreach testing. We've been able to continue to do in-house testing on Mondays and Wednesday evenings from 6 p.m. to 9 p.m., where it's free and confidential. Walk-ins are welcome. And then we've also been able to offer free in-home HIV test kits. So where if someone can't make it to our testing hours, they can come by during our regular hours and pick up an in-home test kit and test themselves at the comfort of their own home.
That's great. That was great. That was really great.
Really monumental to be able to come together as a community and celebrate how far we've come. We came from essentially not having any medication or treatment, where hundreds and thousands of people were dying, to where now we can get it to where an individual living with HIV can live a long, healthy life if they are in care. And so being able to celebrate that with friends, with family, with community is really amazing. And also just as a reminder of how far we've come, but also a way to pay respect and homage to those whom we've lost to the virus. So that to me is one of the many reasons why this day in particular is so important, not just to me, but to everyone.
Good. Last question.
So aside from our regular testing at evenings, which are Monday and Wednesdays from 6 to 9, and our free in-home test kits, we also have a emergency program called Outlast. So for that, all you need to do to qualify is be 25 and up and be a trans person of color or someone who is LGBT and undocumented, or a person who is queer and living with HIV, and or an LGBT person who is 55 and older. And essentially what this program allows is to give you financial support, where you can get $500 for rent, utilities, you can get help with transportation, you can get help with groceries. There's also free mental health. And It's a service that is available to the community, and they can apply for it monthly. And you can visit our website at www.outmemphis.org.
So when I think of World AIDS Day, I think about the fact that the first time I was exposed to people living with HIV and AIDS, it was 1985. And back then, we didn't understand so much about the disease. It was a death sentence. It was a very dark and scary time. But back then, all of those beautiful young men, they came together and they formed a family, and they did the best that they could. And they learned that you need to enjoy your life every day for the gift that it is, because tomorrow is never promised to anyone. Fast forward to 2020, and we have cocktails and medications and PrEP, and HIV and AIDS is no longer a death sentence. It is a way of life. And a lot of the help and support that our people receive today had to be fought for over many, many years. But the benefits are there, the help is there. We always need more, but there's so much more today than we ever could have imagined. And so World AIDS Day, December 1st for me, and especially here at Holy Trinity Community Church, United Church of Christ, a church founded by LGBTQIA people at the height of the AIDS epidemic here in Memphis 30 years ago, is bittersweet, because we actually celebrate the progress that we've made, the advances in medicine, the reality that we knew so little about the disease when it first happened, and now we know so much more. The fact that it used to be about death, and now it's about new life. And while it is different, the same lesson is learned. Live every day for the gift it is, because tomorrow is not promised to anyone. Come together with the people who love you to support you to get through this, whether it's signing up for PrEP or being diagnosed and receiving treatment, or loving someone who is doing either of those things. There used to be so much shame around it, and there still is, but it's not the same. It's different, but it's still there. So December 1st, World AIDS Day, is a sad day, because so many of us remember all of those beautiful people who have died of this terrible, terrible disease. Especially for me personally, those people who died when we didn't know why they were dying, what the disease was all about, even how it worked. But it's also a day of celebration, because we have come so far. And we have so much farther to go, but we know that we can do it. And we know that we can do it because we already have. And both the early generations and today's generation carry the same message. Live each day for the gift it is. Live each day for today, because tomorrow is never promised.
Hello, everyone. I'm Sandra Kimball here at Sacred Heart Southern Missions. I am the HIV coordinator, the Sacred Heart Social Service Minister for the Walls and Northern Mississippi area. I actually see clients on different levels, whether they're HIV positive or not. I have been at Sacred Heart for 5 years, and Sacred Heart has actually been here since 1942. The HIV program has been going on since 1993. For the Walls area, or the Mississippi area, should I say, is what makes us unique, because we're the only organization that actually works with the HIV client population. If I can take a few minutes to tell you how we do this. Since the pandemic has started, everything we do is outside of the office. The clients come up on the parking lot, they call, you hear the phone ring, and we go out and we let them know that we are here by giving them their services on the outside of the building. Of course, Sacred Heart is a food pantry, first and foremost. But what makes us unique and different from anyone else is that we also provide household items for our clients that are in need. If either one of our clients have a need of bedding, towels, or something to decorate the home, we have a gift in kind here on premises that we are actually able to give items from. If they're not able to, if we don't have them here, we have a thrift store that's in Hernando. That is in one of our 6 surrounding areas that we serve, because we have 6 different locations. Our Hernando office area serves with the thrift store and also the clients in that area. Anyone that is affected by HIV comes directly to Walls, regardless of where they are. Walls, Tate, Marshall County, they all still come to Walls. If they're not able to make it here, I do home visits in that area. So I go to Senatobia, Coldwater, Tate County, Marshall County on a monthly basis. And the benefits of being in with Ryan White is the actual EFA services that we are actually able to offer the clients that's even in our surrounding areas. They can also get EFA from here through here as well. And we are so appreciative of being able to work with the Ryan White program. And under the grant for the last 5 years, it's been my sole primary workmanship. So with Sacred Heart, and I'm so grateful to be there.
Hi, my name is Mark Vortiz. I'm the Ryan White Director here at Aaron E. Henry Community Health Center, where we provide comprehensive healthcare service for all our HIV and AIDS clients. Our Ryan White consists of 4 parts: Clarksdale, Batesville, Tunica, and Coldwater. We provide Ryan White service for Part A and Part C. Our Part A consists of HIV specialty care, oral health, EIS services, medical case management. Our Part C service provide of HIV medical care, case management, oral health, behavioral health, and vision.
To work alongside of these individuals to provide the services to individuals who are impacted by HIV and AIDS in our community. I would just like to say that being in this role as Deputy Administrator for the Ryan White Program, I have met some extraordinary people, those who I call friends, family, colleagues, and just downright good people. So we'll hear from some of the advocates that do the work in our communities.
I am a wife, a mother, a community health worker, an HIV advocate, an African American woman.
I am a very compassionate person, a loving person, very nurturing, very caring.
At first, my family didn't support me at all. I have one favorite person in my life. Her name is Jocelyn. She's been there since the beginning. But once I educated my family about HIV and AIDS, they came around to help be more support. Being that if you don't know about the disease, you're going to be afraid of it.
It was shock. It was fear. It was hurt. It was pain. I mean, it was just a flood of emotions all at one time. And I really didn't know how to respond.
World AIDS Day is important to me because it's something that not only affects my community, but it affects me in my personal life. It's important because it allows for individuals to take a walk in other people's shoes and kind of see not only just some of the burdens that some people live with, but just some of the successes that people who are affected and infected by the disease.
I think that it is very important that each and every one of us know a little, well, if not a little, as much as we can about the virus and how it's contracted and how you can get help once you do contract it. And that, it's not a death sentence, like I said. You can live with it. You don't have to die of it.
World AIDS Day is important to me because it's a time where we all can come together and commemorate the lives of those who are still fighting the disease and those lost to the disease. It's not just a one person or one group issue. This is something that we all deal with in one or more ways, shape, forms, or fashion.
Us, we are blessed in America to have a Ryan White program and so on. A lot of the individuals that I called off the countries, they don't have a lot of things that we have. So we mustn't take things for granted.
Last year, the flu was our biggest concern as something that ravaged people. And this year, going forward, now we have COVID. And that alone has taken a toll on some people's mental health. I know some people have lost individuals due to this. A lot of relationships have been shifted, have been altered, have been ended because of this epidemic, this pandemic that we have going on.
You're not alone. You're not the first person who has had it. You're not the last person who's gonna find out, who has it. You are still the same person that you were before you found out about your status. And that you are valuable despite whatever it is that you have been diagnosed with.
I have next to introduce our health officer, Shelby County Health Department, Dr. Bruce Randolph. Dr. Randolph received his Doctor of Medicine degree from the University of Florida's College of Medicine. He received his Master of Public Health from Johns Hopkins University School of Public Health. He has been practicing medicine for over 30 years in various settings such as rural health, urban health, student and college health, etc. Dr. Randolph is currently serving as our health officer, as I mentioned earlier. In this role, he has many responsibilities, but one of them is the privilege of being my immediate supervisor. We want to allow Dr. Randolph the opportunity to come and just share with us some words and also provide a presentation that you will not want to miss. Dr. Randolph.
Thank you, Ms. Horns, and greetings to everyone on this special day, this special occasion. Thank you for the opportunity to be able to just share a few words, I would say words of encouragement. Today we celebrate the World AIDS Day, a time where we reflect on the loss of loved ones, those who are experiencing or living with HIV and AIDS. But we also use this time to reflect and think about the progress that we've made over the years. I'm of the age, as a matter of fact, back in 1981, while in medical school, we began learning about this peculiar disease that seems to be affecting people and affecting their immune system. And I remember, as some have already shared, that at that time, if you were diagnosed with HIV/AIDS, it was almost a death sentence. And I remember the suffering, and I remember the dying, and I remember the reaction. One thing that we should remember as we reflect on this day is the activism and the advocacy that was involved in getting us where we are today. The Ryan White program, I remember there was a lot of debate in the media about this young kid who was a hemophiliac and had gotten infected because he'd gotten blood transfusions, and how he was mistreated in school out of the ignorance because people didn't know. But how those affected by this problem organized themselves and became proactive not only in terms of pushing for additional funds, but also in education and preventive measures. Actually, as we reflect on what we are confronted with today with the COVID pandemic, there are lessons that we can learn from the response that we had as a result of the HIV/AIDS pandemic, epidemic. Because I think in order to us overcoming the challenge that we face today, it's going to require that same level of progressiveness, advocacy, activism, in terms of educating people about the importance of mask wearing, separation, and doing things that they themselves can do, just as those before us who dealt with this epidemic pushed things like condoms and getting tested and knowing your status. And to the point now where we're talking about ending the epidemic, the HIV epidemic. We're at a point now where through progress, through research, through medication, it is now possible for a person who is undetected to not be transmitting or infecting anyone. You know, so zero actually is becoming zero. Zero detection, zero transmission, zero infection. And so that's what I would like for us to remember, as well as we remember those loved ones gone before us. And it's important that you remember, because as long as you can remember, as long as you can recall the name of a loved one, that loved one still lives in you. The person has not completely died until he's no longer remembered. So I encourage you to reflect on your loved ones on this particular day. And sort of as I sort of end this, I'm sort of reflected on, there's this memorial quilt that was actually conceived by an activist named Cleve Jones from San Francisco in 1985. And it was designed to help folk to remember and to not forget. And there's one of my favorite groups who sang a song about this quilt that I encourage you at some point to go on the internet and see. Sweet Honey in the Rock sings a song called The Patchwork Quilt. And there's just a one line that ends that they say, "You will live forever. You know that I'll be loving you just like a patchwork quilt." And that's it. As long as we remember, we continue to love and we continue to hope. And that actually leads me into our recognition of our light of hope. Where I'm from, in the country, we used to sing a song, "This little light of mine, I'm gonna let it shine." And so we have here each year an awards that we give, the health department gives to individuals, to businesses, and an organization in the community that has demonstrated activities to increase awareness and increase understanding of HIV and AIDS in our community by awarding the Light of Hope Awards to the deserving recipients. We need hope. Hope gives us the drive to continue. So the first Light of Hope Award was given out in 2000. And the purpose of this award is to acknowledge the efforts of those within Shelby County that were working to provide the services for people living with HIV and AIDS, PLHWA. and who created policies and increased the quality of life, the PLHWA community. So our first recipient, it is the individual Hope Award recipients, Dr. Nathaniel Boutte, PharmD, has been working as a pharmacist for over a decade. His professional career started as a staff pharmacist at Walgreens in the heart of Memphis, working closely with both HIV patients and underserved communities. From staff pharmacist to pharmacy manager to preceptor to mentor and everything in between, Dr. Nate has worked every role of a pharmacist. He currently serves as the registered store manager for the specialty branch in Walgreens known as Community, focusing on removing the barriers of both patients and providers in HIV, oncology, organ transplant, and hepatitis C. If you know Dr. Nate, you know that he loves taking care of patients. And his what's best for the patient philosophy drives his decision, always teaching teams that he leads while identifying talent in team members and putting them in the best place and opportunity to constantly improve themselves. The only one thing that he loves more than taking care of patients is spending time with his family. From his wife and 2 kids to his 3 sisters, he knows that nothing is more valuable than time itself, which explains why he is so passionate about getting his patients the care they need so they can have more time with their families as well. Let's hear from Dr. Nathaniel Boutte.
Hey, how y'all doing today? So honored and humbled to receive this recognition for doing something that I really love to do. As Dr. Randolph just said, I absolutely love to take care of patients. It really brightens my day, makes my day. It's why I do what I do. So got the award here. Just a great thank you to everyone involved. And yeah, that's pretty much it.
We thank you, Dr. Boutte, for all that you've done, and may you continue to work. Our next recipient is the excuse me just a second, is the business recipient. And this award goes to Spirit Health Medical. Spirit Health Medical was founded in order to incorporate primary care, wellness for persons in a faith-based environment, led by Dr. Mary E. Bernard and Dr. Marche D. Turner. Spirit Health is of the newest HIV provider in Memphis and is quickly becoming the provider of choice for people living with HIV and AIDS. This is evident and well as part of the health philosophy, which states, and this is their philosophy, we believe that a client engaging atmosphere is at the heart of wellness and health. Patients have the right and are encouraged to participate in their own care. We are committed to delivering compassionate, holistic care in a competent, ethical, and caring manner to all patients, regardless of race and gender and sexual orientation, age, our religion. This approach has shown to increase adherence, thereby decreasing the healthcare costs tremendously. And that's their philosophy. That's how they're practiced. We only wish that more and more providers had that philosophy. We would be better off. So let's hear actually from Spirit Health Medical, Dr. Bernard and Dr. Turner.
I'm honored, I'm humbled, and I'm grateful.
Thank you. And we want to just say thank you. Thank you to our families. Thank you to our amazing staff, our board members, to our partners in the community, and most importantly to our patients. We do this for you all. We have been set on a journey, and our steps have been ordered, and we are just so blessed to be able to take this journey and to be able to take this journey with all of you. Thank you. Thank you for the recognition. We greatly appreciate it. Thank you.
Thank you.
And we thank you, Drs. Bernard and Dr. Turner, and may you continue the great work that you're doing and the great contribution that you're making to the citizens of Shelby County in your endeavors. Our third and last recipient of the Light of Hope Award 2020 goes to an organization. The organization that is deserving of this award this year is the Adult Specialty Care Clinic, known as initially ASC, at Regional One Health. The Adult Specialty Care is one of the organizations to offer health care and support services to the PLWHA in Memphis. Their goal is accordance to the goal of that of the national end the HIV epidemic, which is to move more quickly to identify high-risk HIV positive patients and to get them to a undetectable HIV viral load level, encourage them to engage in low-risk activity, and to help people live a healthier and long life and to reduce the transmission of this virus. So some of the services that the Adult Specialty Care offer at Regional One includes early intervention services, primary specialty medical care, infectious disease specialists, HIV nephrology, clinical pharmacy, satellite pharmacy, nutritional counseling, HIV psychiatry and mental health counseling, medical case management, including referrals to other agencies providing HIV-related services, and assessing eligibility and enrollment in the Ryan White program. ASC has a long relationship with Shelby County Health Department and St. Jude, Christ Community, Memphis Health Center, and infectious disease specialists in the tri-state area. Without the services rendered by ASC, many people, many of the PLWHA individuals would go without care, would not receive the necessary medical treatment that they need. So we're very thankful for the services that the Adult Specialty Care offer, and we pray that you continue to provide it, continue to meet the needs of the most sickest of the sick, poorest of the poor, and continue to receive national recognition for a job well done. So let's hear from the Adult Specialty Care at Regional 1.
Thank you, Dr. Randolph. This is an amazing opportunity for us. We have definitely are in good company with everybody who's on the platform with us who are receiving this award. Congratulations to everyone else. We're really grateful to be here. We've been serving this community for over 33 years and just excited about it. And as you see, we have a team here because it takes a team to get this done. And we're just excited. And thank you so much for the award. And I'm going to let Dr. Summers.
Hi. So thank you everyone for this wonderful honor. It is really a community. It's just an honor to win this award alongside all of our partners who have been mentioned before us. We are so excited and we feel just blessed and honored to be able to walk with you in this journey. So thank you for including us in your care, everyone who's watching today, who we are touching. We just really appreciate this. We don't take it lightly. So thank you.
And for those of you who don't know, this is our medical director, Dr. Nathan Summers. Okay,
Hi.
Melissa. Come on.
Thank you. Just thank you. Thank you.
We appreciate it. Thank you.
Thank you.
Okay.
Again, that ends our recognition of our recipients of the Light of Hope Awards. Again, I want to congratulate all of you and encourage you to continue the work that you're doing. As I once said, because your work will not be in vain. Let's continue the hope. Let's continue the struggle. Let's continue the commitment. Let's continue the fight until indeed there is an end to this epidemic. Thank you.
Hi, I'm Sharon Moore Edwards. I'm the practice manager for the Adult Special Care Clinic here at Regional 1 Health. I'm here with my teammates, Melissa Hussey Wright, the manager of support services, and our medical director, Dr. Nate Summers. We're here to talk about the premier services that we provide for the HIV/AIDS community here in Memphis and Shelby County. We've been providing these premier services for over 35 years, and we're just going to talk just a little bit more about that. But before I go, I just want to thank everybody in the HIV/AIDS community and the Memphis and Shelby County Health Department for all of the hard work that we have been doing and that you allow and help us to do in this community. All right, Melissa.
Good morning. My name is Melissa Hussey Wright, and I am the manager of our support services here at Regional 1 Health Adult Special Care. I want to talk about some of the services that we provide in our support services area. We have medical case managers that provide assistance to patients that need recertification of their Ryan White. We also make appropriate referrals in the community for substance abuse, mental health referrals. We also have EFA, which is emergency financial assistance, where we provide utility assistance to our patients. We also have medical transportation to our patients, where we provide transportation to our patients in the form of a 31-day bus pass, an all-day bus pass, and a 21-day bus pass. We also provide free transportation to our patients in the form of a gas card when they come to their medical appointments. We also have free parking in our clinic, so there's never any fee for our patients to come to our clinic. We have a lot of services that we provide, and these services are all to support our medical services. And we hope that these services will continue to allow our patients to continue to come to their medical appointments and be virally suppressed. Now to Dr. Summers.
Hi, I'm Dr. Nathan Summers. Thank you everyone for giving us the opportunity to be here today. And thank you, Melissa and Sharon. So I'm really excited to talk to you about the medical care that we have here at Adult Special Care and at Regional 1. We really strive to be a patient-centered medical home here, as much as possible a one-stop shop. And so we have a fantastic staff of fantastic infectious disease trained doctors and nurse practitioners. And for the majority of our patients, we serve as your primary care physician. That said, for some patients who already have primary care physicians, we're not in the business of stealing patients. And so if you want us just to manage your HIV, we're happy to do that as well. It's really whatever's best for the patient and that individual. But as I mentioned, we try to be as much as possible a one-stop shop. We try to have as much as possible housed within our clinic. And so in addition to having your medical provider, we also have a staff nephrologist. So if you develop any kidney issues or kidney problems as a result of HIV or other medical conditions, we've got you covered. We also have clinical pharmacists who provide a resource not only to the physicians when we have difficult cases and worry about drug interactions. They're an invaluable resource, but they're also a fantastic resource to our patients. So if patients have questions about how to take medications with or without food, drug side effects, it's an invaluable resource to our patients as well. We also have clinical mental health counseling, and we're getting a psychiatrist in clinic as well. So whatever you have, we've got you covered. We also have a nutritionist available. So if food is scarce, or if you are needing some nutritional supplements like Boost, we've got you covered as well. Or even diet counseling for diabetes, we've got you covered for that. So as much as possible, we really try to have as much as possible within the clinic. That said, we can't have everything inside the clinic, and so we are very blessed and lucky to be housed within the outpatient center at Regional 1. And so if you do need to go somewhere else for a GI doctor for a colonoscopy, or an endocrinologist for thyroid issues, you don't have to travel far. It's still within the same building. It's just maybe going down 2 floors to get your colonoscopy done. And I think that's just really an invaluable benefit to our patients. And so really, thank you for letting us participate in your care. I am speaking for myself and all of the providers at Adult Special Care. It is truly an honor and a privilege that we don't take lightly. So thank you for letting us join in your care.
Epidemic, we began a clinical program at St. Jude Children's Research Hospital. In 1987, at the height of the HIV and AIDS epidemic, we began to see more babies and children being born with HIV. It was then that our founding father, Danny Thomas, declared that HIV would become a priority for St. Jude. We have a multidisciplinary program that focuses on providing excellent care for perinatally infected youth and young adults, for children, for babies, and also those that contracted through behavioral outcomes. We love partnering with Ryan White Services in order to provide excellent care for our children, for our babies, and for those young adults that come to see us.
Thank you, Andrea. Our multidisciplinary team comprised of infectious disease specialists that work with pediatric, adolescent, and young adults to address HIV and how it affects the body. Our licensed clinical social workers are available to address any environmental stressors and barriers to care for our patients. We have on-site psychiatry and psychology who specialize in pediatric, adolescent, and young adult mental and emotional health, as well as a on-site pharmacy, which our pharmacists use age-appropriate methods to address medication adherence. Last but not least, our community outreach team keeps their fingers on the pulse of the trends and behaviors that are going on in our community. We have intensive case management for anyone between the ages of 13 to 24 for those who receive care at St. Jude, as well as those who receive care at other agencies. Currently, we are working on an ending the HIV epidemic plan with our community partners to address policies and practices that will affect HIV care now and in the future. We want to thank our partners with Ryan White for all of their help.
You know that I'll be loving you just like a patchwork quilt. Oh, your lies had meaning and your lies had joy. You touched so many people, many more than you know. And you wrap yourselves around me as I walk down these roads. You're letting me feel your beautiful souls. I feel the warmth of your lies. I feel the warmth of your lies. Oh, and you will live forever. You know that I will love you just like a patchwork quilt. Ooh. heart spills over, flowing with tears. I cry for your suffering and for your shortened years, and I'll take you with me as I walk away, remembering you who have died with AIDS. Yes, I remember your name. Yes, I remember your name. Oh, and you will live forever. You know that I'll be loving you just like a patchwork quilt. I'll be loving you like a patchwork quilt. I'll be loving you like a patchwork. I'll be loving you. I'll be loving you like a patchwork.
Welcome back again. We are just excited to bring to you the next segment of our program today. I'm honored to be introducing one of the advocates that work actually in our office. Mr. Denford Galloway is our Planning Council Manager. In his role, he is responsible for ensuring that we have the number of individuals for different subcategories to serve on our Planning Council. The Planning Council is responsible for allocating how we spend the federal funds that we receive from HRSA. They do that in a process that takes all day, sometimes 2 days. And Mr. Galloway ensures that they have all the resources that they need to make those kinds of decisions. Mr. Galloway is joining me today to just give us a little bit about why he has been doing this type of work and what it means to him. So, Mr. Galloway, tell us a little bit about why you do the work that you do.
Wow. Why I do what I do? Mainly because I've been living with HIV myself for over 15 years. And it's not just a job to me anymore, it's personal. And it's something that I enjoy doing. If I had to say my second goal in life after I contracted HIV was to be able to work in this field, to help others continue to realize that they have hope even after they contract HIV and AIDS. And it has just been an honor, and not only just an honor. When I first contracted HIV and AIDS, I was lost. I was in fear. So being able to be around people that know what I'm going through, is walking the same walk that I'm walking, was a help to me. So when I first got into HCAP, it wasn't just about, okay, I want to be a part of HCAP. It was to find a niche to be around people, like I said, that's going through the same thing in life that I'm going through. So that was one of the main reasons I became a part of HCAP, and it went on from there.
So you mentioned that you joined HCAP to garner the support. Tell us a little bit about the support that you received in HCAP and what HCAP really meant to you at that time.
And before I tell you about what support that HCAP meant for me and gave me, after I found out HIV positive, it's not something that I share with my family, my immediate, my siblings. It's not something that I talk to them about. Matter of fact, I can say to today's date, I have never had a conversation with my family members about what I'm going through. You have fear about sharing that with people. You not sure how they're gonna react, whether or not they're not gonna ever want to speak to you again, whether or not they're not gonna want to sit beside you or touch you or what have you. So becoming a part of HCAP, it's gave me the support I need mentally. Mainly, I was able to talk to people and find out how they dealt with being HIV positive. When I said people, these people that are living with HIV positive, but not only that, the support of the psychosocial medical help that I got to help me deal with the depression and things of that nature. So that's the kind of stuff I got from HCAP. And not only that, receiving that, being a part of HCAP helped me to be able to be the CEO of my own life, so to speak, where I could help make decisions on how money was going to be spent to help myself and people that was living with the same thing I'm living with. So that's what HCAP has really done for me.
It's just interesting to me that you mentioned it helped you to be the CEO of your own life. And I think that's probably something that's going to stick with me from here on out. Because when you said that, it really made me think that's actually what's happening. Those individuals who become a part of our HIV care and prevention planning group, which is what HCAP stands for, really have the opportunity to have a say-so in how those funds are spent and what services they really want to have in our TGA. So I think that's a really poignant thing that you said about being the CEO of your own life. So with that said, tell us if you ran across or came across an individual who was newly diagnosed, what would be the 3 things, if you just had to choose 3, that you would tell them?
One, the first and foremost would be to let them know and assure them that your life is not over. HIV is not a death sentence anymore. So there is life after HIV. And some of the other things that I would tell them as well is that let's get you into care, okay? Let's get not only medical support, but physical support as well. Help you be around people that know what you're going through, and you know, and to get you in care and keep you into care, because as someone mentioned, Dr. Randolph mentioned earlier about undetectable. That's the thing about care. If you get into care and taking the medication that you need to be taking, then you can become undetectable. U equals U, and scientifically speaking, you don't have to worry about spreading. That leads to this epidemic, the epidemic that we are going into. If you are undetected and cannot spread it, then we can eradicate and we can stop from being spread. The other thing is that I would help them. I know it was a big fear of mine of being able to tell my closest family and friends what I'm living with, what I'm going through.
Mm-hmm. Okay. Now, I have listed on my notes to ask you why World AIDS Day is important to you. And that's pretty evident, I think, just with what you said so far. So I'll switch it. Tell me or tell us why you feel like World AIDS Day should be important to all of those who are in our community, whether they are HIV infected or someone who's living with HIV, I should say, or not. Why should World AIDS Day be important to all of us?
And it should, and the reason I say it should be important to everyone, because if you don't know about HIV, if you don't understand what it does and how you contract it, and that's what World AIDS Day does. So if you don't know those things, then it's most likely that you could very well contract it yourself if you are not careful, if you're not educated, if you're not made aware of what's going on. And that's what World AIDS Day does. It makes people aware of what's going on, about getting tested, and to get tested and know now and live longer. And I can relate to that slogan so very well, because had I not known that I had HIV, I couldn't live at all. So since I've known and able to take my medication, I can live longer. So know now, live longer. So that's what, this day should mean to everybody, to make sure they know what it takes to not contract HIV.
Thank you so much for that, Denford. One of the things I thought of when you said that, just being in this position and working with you every day, I tell you all the time that if I could just clone you, it would make just the world a better place. You're an awesome individual. I respect you wholeheartedly and enjoy working with you every day. But even just outside of that, you are a dedicated family man to a beautiful, beautiful wife, and a daughter and a son and grandchildren that, you know, you adore. You exemplify just the utmost presence of a man. So I just want to say it is an honor working beside you every day. And I just think that who would not be inspired, whether you are a person living with HIV or not, to have someone like you to look up to and to give them some input on what it's like in this fight and in this advocacy working around HIV and AIDS. So thank you for the hard work that you do. And I just really want to close with, is there anything else that you would like to add or share before we end this segment? And before I throw it to you, Denford, when we were talking about doing this segment, I was a little nervous. I was a little nervous, and not just nervous for not really wanting to ask you questions that you didn't want to answer. But of course, you, in true Denford fashion, just whatever you can think of, whatever comes up, I just want to share my story with people, and I want to inspire people. So I just want to say thank you again for being so transparent and open and willing to share.
And thank you for those kind remarks, Sherry. And like I said, I enjoy what I do, but I wouldn't be able to do this if I wasn't well, if I wasn't receiving the care Ryan White Office provides through the providers that we partner with. So that's one reason I'm able to hold down a job, because the support that all of the providers provide, and not just me, but support to all of the consumers, as we call them. It's open, it's free service for anyone living with affected by HIV and AIDS. So I encourage you, if you are living with HIV and AIDS, no matter what race, creed, or color, Ryan White provides those free services for you. So I encourage you to get Ryan White certified and come get those services to help you live better, a longer life and a productive life, and you still can live a life out the HIV and hold down a career.
Those are very valuable points. So we will end our Let's Talk About It segment, as Denford has so named it. We hope that you all have learned something valuable to take with you as part of our World AIDS Day program. And we just want to say that we have added the word thrive to our Memphis Ryan White slogan. It used to be know now, live longer. But you know, now because of the medications that are available, we thought it important to add thrive, because that's really what we want to see. We want to see individuals live longer, healthier lives, and be able to share quality of life that normally would happen without HIV. So we're excited about that, adding thrive to our slogan. So now we are know now, live longer, and thrive. It is just so important to understand that it really takes all of us in order to do the work that fuels the quality of life for our clients and our consumers who are living with HIV and AIDS. And we would not be able to do that. It was in an attempt to show you that it really does take a village to do this work. So we've shared with you a lot of our subrecipients, those who are funded by our program to provide quality medical care and support services to our clients. But we also want to hear from some of our other partners. One in particular is our Tennessee Department of Health family, and then after them, we'd hear from our partners at Shelby County Schools. So we'll have Kim Truss, Prevention Director, Tennessee Department of Health.
Thank you. Good evening, everyone. And for those of you who may not know me, again, my name is Kimberly Truss, and I serve as the HIV Prevention Director for the Tennessee Department of Health, or TDH. First, I want to say thank you to Ms. Sherry and the Memphis Ryan White program and HCAP for inviting me to speak at this World AIDS Day event. I am honored to be a part of the program. Memphis, as we know, is at the center of the HIV epidemic for Tennessee. In 2018, Memphis accounted for 40% of the diagnoses in the state. Over 37% of people living with HIV were living in Memphis. I want to take a moment to briefly highlight some of the prevention services supported by TDH in Memphis that will help us to end the epidemic. The TDH prevention program supports the services provided at the Shelby County Health Department, including disease intervention services like partner notification and HIV testing, as well as helping to establish the new PrEP clinic. We also financially support 6 local community-based organizations to run programs for testing, PrEP navigation, condom distribution, and training for new testers. These organizations also implement 4 individual and group level interventions supporting the prevention needs of the communities for Latinx people, trans women, and same gender loving men. And the ARTIST program or intervention is for anyone newly diagnosed but needs assistance addressing barriers to care. Over the last 2 years, 2 organizations were approved to provide syringe services in Memphis, and I'm happy to report that both agencies were also awarded funding in 2021 to help continue its harm reduction efforts. When I say support, I don't want you to think of TDH as only as a funder. The prevention program is made up of 11 passionate and hardworking full-time staff members. We work for you. We work for all of the residents in the state of Tennessee. This team is present, meeting with CBO staff on a regular basis, attending HCAP meetings, listening to your needs, and trying their best to help you address them. Whether it is trying to find a way to help you continue to provide the services in the middle of a pandemic, building new training programs to make sure you're confident in delivering new services, or trying to push for new innovative activities, the prevention team stands with you in solidarity. Memphis is among the 57 phase 1 jurisdictions identified as being most affected by HIV for the National Ending the HIV Epidemic, or EHE initiative. The purpose of the EHE funding is to leverage data, tools, and resources to reduce new HIV diagnosis by 75% in 5 years. There are 4 pillars that EHE activities must address, and those are diagnose, treat, prevent, and respond. The local EHE planning team is working hard to finalize the Memphis EHE plan. I am delighted to announce that Mr. Eddie Wiley will be joining our team as the EHE Implementation Program Coordinator. Eddie will be working closely with the EHE Implementation Committee and the Shelby County Health Department to bring the plan to life. I want to close by showing gratitude for the leaders in the HIV field who are here now, for those who we have loved and we have lost, for everyone living with HIV and doing it well, and to say to all of you that TDH is here with you to see us through to end the HIV epidemic. Thank you.
Thank you so very much, Ms. Kimberly Truss. It is always nice to see and hear from you. Thank you for the partnership and the hard work and always being available when we need you. Thank you again so much for the work that you do for the residents of Shelby County and our Memphis TGA. Next, I want to just go right into our World AIDS Day Light the Sky commemorative event. This was held on Tiger Lane on November 17th, but we wanted to share with you just the importance of thinking of those who are living with HIV and AIDS, those who have passed, and really those who are doing the work to support people who are infected or affected by HIV and AIDS. So now we'll share with you our Light the Sky event.
I'm thinking about the lost generation, and before pre-heart, before we had these regimens that sustained our lives, that I lost a lot of friends, and they're not here with me, and we don't know the potential of that lost generation. But I'm here to celebrate them and the memory of them and those that live and survive with this virus in the city of Memphis. So that's what I just want to mention, that lost generation, and just remembering those people and being so grateful to be here among the living.
So the white balloon, I'm going to make sure the white balloon is for the people who we have lost to HIV. Anyone that you may have, come in your mind that may have passed away due to complications of HIV, please grab a white balloon. It looks like we got more here. The red balloons also are for those people who are living in power. And our theme and what we've been implementing and also, trying to push is know now, live longer, and thrive. So that's why we're here today. And it takes all of us, whether you have a negative or positive status, and knowing your status is very important, all of us together, that's how we're going to get past this and be able to actually find a cure for HIV.
Hello, everyone. My name is Portia Knowlton, and I'm a Special Projects Coordinator for the Department of Exceptional Children in Health Services in the Office of Coordinated School Health for Shelby County Schools. I'm so excited to be here today to share with you about a great day that's right around the corner, World AIDS Day. Within my job, I have the opportunity to go within the schools and talk to students about the importance of staying healthy and how everything correlates together. But I also have my amazing colleague here that'll tie all of this together as he'll come in and talk to you guys about his grant and how it relates to HIV and AIDS.
Thank you, Portia. Appreciate it. So my name is Martavius Hampton. I'm also with the Department of Exceptional Children and Health Services. I'm a Special Project Coordinator, and I'm supported by a CDC cooperative agreement. So my team and I help to promote adolescent health through school-based HIV and STD prevention. So what we do is focus on 3 program strategies. That's sexual health education, sexual health services, and safe and supportive environments. So how do we do that? No. So what we do is we help to support staff capacity, we increase student access to programs and services, and we engage students and staff and community partners and parents. We do that. So on this World AIDS Day, again, we want people to be educated. We want the awareness to spread continuously every year. So Portia, come on, tell us the end of it.
All right. And excuse how we're running in and out. We are still practicing social distancing with COVID still going on. We want to make sure that everyone stays safe. But the thing that we want you to remember is until there's a cure for HIV, we have to always remember to know our status, be aware, be educated, and get tested, okay? And with that being said, never forget the ones that came before us and the ones that we're still celebrating. We'll talk to you later. Happy World AIDS Day.
Take care.
Hi, I'm Sharon Moore Edwards. I'm the practice manager for the Adult Special Care Clinic here at Regional One Health. I'm here with my teammates, Melissa Hussey Wright, the manager of support services, and our medical director, Dr. Nate Summers. We're here to talk about the premier services that we provide for the HIV/AIDS community here in Memphis and Shelby County. We've been providing these premier services for over 35 years, and we're just going to talk just a little bit more about that. But before I go, I just want to thank everybody in the HIV/AIDS community and the Memphis and Shelby County Health Department for all of the hard work that we have been doing and that you allow and help us to do in this community. All right, Melissa.
Good morning. My name is Melissa Hussey Wright, and I am the manager of our support services here at Regional One Health Adult Special Care. I want to talk about some of the services that we provide in our support services area. We have medical case managers that provide assistance to patients that need recertification of their Ryan White. We also make appropriate referrals in the community for substance abuse, mental health referrals. We also have EFA, which is emergency financial assistance, where we provide utility assistance to our patients. We also have medical transportation to our patients, where we provide transportation to our patients in the form of a 31-day bus pass, an all-day bus pass, and a 21-day bus pass. We also provide free transportation to our patients in the form of a gas card when they come to their medical appointments. We also have free parking in our clinic, so there's never any fee for our patients to come to our clinic. We have a lot of services that we provide, and these services are all to support our medical services. And we hope that these services will continue to allow our patients to continue to come to their medical appointments and be virally suppressed. Now to Dr. Summers.
Hi, I'm Dr. Nathan Summers. Thank you everyone for giving us the opportunity to be here today. And thank you, Melissa and Sharon. So I'm really excited to talk to you about the medical care that we have here at Adult Special Care and at Regional One. We really strive to be a patient-centered medical home here, as much as possible a one-stop shop. And so we have a fantastic staff of fantastic infectious disease trained doctors and nurse practitioners. And for the majority of our patients, we serve as your primary care physician. That said, for some patients who already have primary care physicians, we're not in the business of stealing patients. And so if you want us just to manage your HIV, we're happy to do that as well. It's really whatever's best for the patient and that individual. But as I mentioned, we try to be as much as possible a one-stop shop. We try to have as much as possible housed within our clinic. And so in addition to having your medical provider, we also have a staff nephrologist. So if you develop any kidney issues or kidney problems as a result of HIV or other medical conditions, we've got you covered. We also have clinical pharmacists who provide a resource not only to the physicians when we have difficult cases and worry about drug interactions. They're an invaluable resource, but they're also a fantastic resource to our patients. So if patients have questions about how to take medications with or without food, drug side effects, it's an invaluable resource to our patients as well. We also have clinical mental health counseling, and we're getting a psychiatrist in clinic as well. So whatever you have, we've got you covered. We also have a nutritionist available. So if food is scarce, or if you are needing some nutritional supplements like Boost, we've got you covered as well. Or even diet counseling for diabetes, we've got you covered for that. So as much as possible, we really try to have as much as possible within the clinic. That said, we can't have everything inside the clinic, and so we are very blessed and lucky to be housed within the outpatient center at Regional One. And so if you do need to go somewhere else for a GI doctor for a colonoscopy, or an endocrinologist for thyroid issues, you don't have to travel far. It's still within the same building. It's just maybe going down 2 floors to get your colonoscopy done. And I think that's just really an invaluable benefit to our patients. And so really thank you for letting us participate in your care. I am speaking for myself and all of the providers at Adult Special Care. It is truly an honor and a privilege that we don't take lightly. So thank you for letting us join in your care.
Thank you all so very much for joining us today for our 2020 World AIDS Day program. It is just a wonderful opportunity for us to share the importance of knowing your status. And as our Ryan White HCAP logo, or I should say slogan, insists, please know your status. That way you will know now, live longer, and thrive. I just want to take a couple of seconds to give special acknowledgments to Dr. Elisa Haushalter, Shelby County Health Department Director, the Honorable Mayor Lee Harris, Shelby County Mayor, to Dr. Randolph, our health officer, and all of you who joined us today to make our event so successful. Thank you so very much.